The Executive Director of the National Primary Healthcare Development Agency, FaisalShuaib, has said that the reason for the postponement of the COVID-19 vaccination program was to enable the federal government work with the National Agency for Food and Drug Administration and Control to track and trace the health facility where the vaccine would be administered. Shuaib said this during a press briefing on Tuesday, August 10, 2021. Recall that on August 9, 2021, the federal government postponed the administration of the second phase of the coronavirus vaccine doses due to unforeseen circumstances. Speaking on the postponement, Shuaib said,
"Why we've had to extend or postpone the launch date of the vaccine is because we want to institute once again, in conjunction with NAFDAC, the track and trace all the way to the health facility where the vaccines will be administered. This means that we are locally creating labels for the vaccines, barcodes that will ensure that this tracking and tracing continues just like we did in the first phase. Consequently, we want to call on all Nigerians to remain assured that the vaccines that we have are safe and they are effective, and we're going to deploy them next week, as we have earlier communicated, that we will do the flag off and the rollout of the second phase of the COVID-19 vaccination program on August the 16th, 2021. I want to mention that the delay that we witnessed in the rollout of the vaccine is as a result of our continued commitment to work with our partners, with other agencies, and ensure that when we roll out the vaccines, they are as successful as we witnessed during the first phase of the vaccination.
He noted that the first phase of vaccination rollout and collaboration between NAFDAC and NPHCDA led to the first ever tracking and tracing of vaccines globally. He said the tracking system made it possible to monitor the vaccine.
Rollout, the collaboration between NAFDAC and the National Primary Healthcare Development Agency led to the first ever tracking and tracing of vaccines globally. This tracing and tracking of vaccine from the national level to the sub-national level to the point of administration was conducted for the very first time in this country as well. This is an innovative mechanism that made it possible for us to clearly monitor our stock balances and follow the vaccines from the National Strategic Cold Store in Abuja all the way to where the vaccines are administered. This has never happened before in Nigeria. This is why when we communicated to Nigerians that we had finished the first phase of the vaccination on the 9th of July, we actually finished all the vaccines that were available. So there were no vaccines available anywhere. This is the accountability that we brought to the COVID-19 vaccination program, because we tracked and we traced all the vaccines. So it was not possible for anybody to go under any bridge in some market to bring COVID-19 vaccines. And this is as a result of the leadership provided by the Presidential Steering Committee, the Federal Ministry of Health, NAFDAC, the NCDC, and of course the National Primary Healthcare Development Agency.
The Executive Director added that over 4 million doses of Moderna COVID-19 vaccines have been donated by the United States government, and over 170,000 doses of Johnson & Johnson vaccines will be received on Wednesday, August 11, 2021.
4,080,000 doses of Moderna COVID-19 vaccine donated by the US government. And we will be receiving 176,000 doses of the Johnson & Johnson vaccines tomorrow, Wednesday, August 11th. These 176,000 doses, as you are aware, are coming out of the 29,850,000 doses that the federal government procured from the African Union through the Afrexim Bank platform.
He also said NAFDAC took some samples of the vaccines to test its standards before approving for use.
NAFDAC took samples of the COVID-19 vaccines to test for their integrity, their consistency with the global standard and what the Nigerian standard is, and to ensure that it is in line with the product information that has been provided by the US government and Moderna. NAFDAC has now come back to tell us that they have approved the Moderna vaccine for use in Nigeria.
Also, there have been questions on which COVID-19 brand is better. Addressing this issue, Shuaib said both the Astrazeneca vaccine and Moderna vaccine are effective against the Delta variant.
Very clear that the AstraZeneca vaccine, the Moderna vaccines are very effective against the Delta variant that we are beginning to see in states, especially in Lagos and Akwa Ibom.
Shuaib also said anyone who is 18 years and above is eligible to receive any brand of the vaccine. He stressed that mixing of one brand of COVID-19 vaccine with another is not allowed.
That any person who is 18 years and above is eligible to receive the Moderna or any brand of COVID-19 vaccine available in Nigeria. However, it is pertinent to state that mixing one brand of vaccine with another brand is as first and second dose is not allowed. Those who have received AstraZeneca as first dose should take it as the second dose, and those who are taking Moderna as their first dose should take Moderna as their second doses. Most brands of the COVID-19 vaccines require 2 doses with varying intervals between these doses for full protection. So for example, Moderna is 2 doses 4 weeks apart. The Oxford AstraZeneca is 2 doses with between 6 to 12 weeks apart. And the Pfizer vaccine is 2 doses with 3 weeks apart. However, brands such as the Johnson & Johnson that we're receiving tomorrow is a single dose vaccine that doesn't require a second dose. And for this Johnson & Johnson vaccine, the initial doses are going to be focused on those people that live in hard to reach areas, right? So people that live in riverine areas, mountainous areas, desert areas, any hard to reach community will have residents being given the single shot, just because we know that it's often difficult to get people to take the second shot. We'll also be looking at how we can give the elderly people because these people also find it difficult to leave their homes and come to the health facility for their shots.
He commended everyone who has taken the vaccine and urged them to encourage others to get vaccinated in order to stop the pandemic.
Must do, especially for the over 2 million people who have already taken the vaccine, is to talk to your loved ones, speak to family members, your friends, your community members, encourage them to also take the vaccine. Because for us to be able to stop this pandemic, we need a critical herd immunity that can only be approached when we reach at least 70% of the eligible population. So it is not just for the public health experts to go out there and try to convince people to take the vaccines, given the information that is available. But since you have taken the vaccine and you have the correct information, then it is also your responsibility as a Nigerian to ask to provide the information to your loved ones, to your community members, and advocate that people should take the vaccine so that we can continue to build the immunity that will ensure that we stop the pandemic and begin to sort of roll back and climb back to our normal ways of living. Please, even as we increase the vaccination coverage across Nigeria, given that we're expecting additional vaccines, we should not forget that we must maintain the public health or so-called non-pharmaceutical measures of wearing face masks, keeping our hand hygiene, and ensuring social distancing.